In 2021, President Museveni directed that the monthly pay for medical interns be increased. He ordered that interns receive half of the salary of fully appointed officers in their respective professions starting from July 2021. This raised their monthly allowance from 750,000 shillings to 2.5 million, with the president acknowledging that the previous amount was insufficient to cover basic living expenses, especially since many interns lived in rented and safe locations far from their training hospitals. However, last year, due to budgetary constraints, the government reduced the allowance to 1 million shillings. Despite this reduction, the Health Ministry says the allocated budget this year is still insufficient to deploy all qualified medical interns, leaving around 1,000 interns without deployment this year. On Sunday, President Museveni, who had previously called for increased intern allowances, proposed that those funding a medical student's education should also be responsible for covering their internship costs due to funding limitations.
If you don't do internship, you have not finished the course. But the question now is who pays for the internship? Some people are saying the government must pay, but I think that one is a bit risky because the government would pay if it had money. But because it doesn't have enough money, it has got money, but it has got so many things to do.
However, the Uganda Medical Association has dismissed this proposal, calling it unacceptable, saying medical interns are qualified doctors who contribute to the healthcare system during their one-year internship.
You don't expect a parent to pay fees for 5 years, go attend a graduation at Makerere, and then again the same parent begins to pay salary to his son or daughter to work on government patients. You get it? It's illogical. It's not acceptable.
Also, internship is work, very heavy work. They go on shifts 24 hours, sometimes 36 hours. And they are the ones who are right there at the front line. When patients arrive in the hospital, it's interns who receive them, who make the initial diagnosis, the initial treatment, before the other people come. So it is work which should be paid, not not taken for granted that you need this training, therefore.
According to doctors, the current 1 million shillings allowance is already insufficient, with some interns forced to live in distant and unsafe areas, making them vulnerable to crime. They say the president's proposal will only make it worse.
He should reconsider his attitude or his opinion about the medical interns. I also think that somehow many people, maybe including some people in government, they deliberately refuse to understand the meaning of medical internship.
If I don't have an intern in a ward, I don't know how I can work. Interns are so important. They are the ones who start the process of taking care of patients. And I think we should not go to a situation where we are saying we don't need interns. Services will collapse. I think we need interns. As to who should pay for them, that's a different question.
The experts say the problem is not in the number of interns, given the current doctor-to-patient ratio, and wants government to improve its tracking and planning for medical interns to ensure better resource allocation.
How many people are going into training? How many are coming out of training? How many are getting employed? How many are retiring from their posts? What vacancies are being created? And what are the skill needs?
They add that the government lacks the political will to allocate enough funds to the health sector and has misplaced priorities.
I think last year they spent over 180 billion on government officials who are flying in Kenya, in the US, in Germany to seek health care. Those people should come and be treated by interns who are hungry, interns who didn't eat, interns who are scared of the landlord. They should come and be treated, and they know they will die also.
Because of this disappointment, now a number of health workers in our social media platforms are contemplating that maybe the government does not see value in professionals anymore. Maybe the government does not see value in doctors and other health workers anymore. And they are thinking that, do we even need to maybe lay down tools, all of us, and go for a nationwide strike, and maybe this is when we shall get a platform.
Stakeholders are warning that if the president's proposal is implemented, it could negatively impact the attitude and ethics of medical personnel. Norbert Atkunda, NTV Tonight.